Well, Friday was the cutoff for the fiscal committees, and now we're on the floor full-time running bills. Bills have a deadline of getting out of the House and over to the Senate within a certain time frame. So, for instance, yesterday we started at 9 in the morning and we went to our places of rest at 11 o'clock last night. So there will be some very, very long days this week as we pass those bills through. Well, we're trying really hard to look at every systemic change through an equity lens. And one of the things that I'm doing that I feel is very, very important is revisiting our cannabis laws and our cannabis systems. It's been 10 years since the initiative passed. Prior to the initiative, we had a decriminalized, registered medical system. We had no idea how many medical patients we really had. And so the initiative was geared towards recreational cannabis. And we didn't pay enough attention to the medical needs of people. For some people, cannabis is very serious medicine for very serious illnesses. It helps cancer patients with nausea, a lot of things. And the system's focus on recreational didn't help our medical patients. And so we're trying to address that. But probably as important, the war on drugs that failed massively when it comes to cannabis was particularly harsh on people of color. And we want to make sure that going forward, we don't perpetuate that and we remedy those injustices wherever we can. When a family has someone incarcerated for what is now a legal behavior, it damages their finances, it damages the kids, and we're still dealing with that legacy. And so doing what we can now that we can is critically important. And I've got a number of bills that are moving through. They won't all get through. That's the normal thing. But the committee that I'm on and that I'm co-chairing is going to do some significant work at looking at what should this system look like, where we balance making sure that we don't perpetuate inequities of the past, that we're fair, that we have a healthy system for those who are playing by the rules, and that we protect the public safety, because there's still things that are being made out of hemp, et cetera, that we don't know the safety of. We need to do more research. We need to do more prevention to protect people, to protect the public safety. And we need to make sure that the industry is transparent about what's in it, what can be proved, make sure the testing works well. So we're taking a really deep dive into looking at our system and saying this is a fairly new system. It was designed by an initiative. And now it's time to say, how can it work better and how can we balance public safety with entrepreneurship and good economics and good business? Actually, there's some really good policy moving through. I spent 6 or 7 years on the technology committee, and we really wrestled with data privacy. And a lot of people think that the horse has already left the barn, but there's a bill that's really critical that will protect people's healthcare data. And it's particularly urgent since Roe v. Wade. We all kind of know that HIPAA protects our healthcare data, but as soon as that data is known by anybody else, it can be consolidated and the most personal information can be sold, and it is being sold. For instance, a woman who is trying to figure out what to do about a pregnancy, her search engine subjects could be sold to an anti-abortion group in another state where it's illegal, and she and her healthcare providers could be targeted for possible violence or harassment or barraged with information that they didn't want. And that's true of everybody. It's particularly urgent because of how healthcare data is being weaponized, particularly targeting women. And we are a pro-choice state. And so what we are doing is trying to make sure that we stay that way and we protect everybody's data. And that was a heavy lift because sometimes what comes back to you on your computer is useful and convenient, but it means that there's an ocean of data about you outside. And if it's healthcare data, if it's out in the internet instead of in your doctor's office, it can be sold and weaponized. And nobody wants that. Nobody wants that. And so we have the first bill in the country. Representative Vandana Slaughter is the lead on that, but she's worked with our Attorney General and a whole lot of other people to come up with a good bill, and that bill is going to come up within a day or so. It might come up today, and that's a very, very important bill.